So recently we've begun work over at the new campus at 663 in Portser Road. What we're really creating there is a first-class facility for our community. The reason behind building the new hospital is really the changing demographics. We're finding that more people are choosing to come to St. Luke's Quakertown for their care. As that demand continued to grow, St. Luke's wanted to meet that need with the best of facilities. This hospital has served us well since 1929 when it was originally built. What we're going to be able to do with the new facility is continue to enhance our services. What's really great about being part of a larger network is we're able to find out what are the needs of this community and then talk to the network about providing those. So with having more land and availability and space out at the new campus, we'll be able to continue to enhance services for the future to meet the needs of our patients and their families.
Over the course of my career, I've seen the hospital grow from a very small community hospital to a much larger, much busier facility. We have more patients, we have more complex patients. We need a bigger hospital, we need a newer hospital in order to continue what we've been able to accomplish here.
With St. Luke's commitment, their mission, and their commitment to excellence in providing health care to communities, our community will have access to the level of care of people who live in big cities. But it will also have the benefit of the network and all of the specialties and the support and the integration of the research and the medical school. All of those benefits will be filtered back into our local community hospitals.
You know, when you're really sick and you go into that ER and those doctors pinpoint what's wrong and help you out immediately, I mean, you feel so fortunate. And then when you come across a physician who is so on top of things and so willing to help you, I mean, I was so grateful.
You know, as a community bank, our success relies on the strength of the community, and having that new hospital built on 663 is obviously going to bring jobs, both during the construction, new jobs with employees working there, and also will support the housing and everything else going on in the greater Quakertown area. So there's a lot of great things that occur because the new hospital is being built.
It's a game changer from an economic development perspective because we know that healthcare dollars are reinvested in the community. We know that St. Luke's is also a good community partner, and so their representatives are serving on local nonprofit boards, and the types of jobs that are provided draw an educated workforce as well as those family-sustaining jobs, which are highly coveted. But not only that, but we have the multiplier effect of people with those levels of income then spending their dollars locally. So it contributes to the local economy, not just through the jobs, but also through the leadership and the engagement in the community. I think it's important for people to find the way that they can give, because if you can contribute financially, that's significant.
St. Luke's has given so much to our community. I think it's a great opportunity to recognize how important St. Luke's has been to the Quakertown community and for the community to give back in this landmark project.
We find it to be an exciting opportunity for St. Luke's to truly partner with the greater Quakertown region and to offer the best in health care to those patients.
The building of a brand new hospital typically happens only once in a century and truly is cause for celebration. The commitment St. Luke's has made to build this hospital here in Quakertown will benefit you, your children, and your grandchildren for generations to come. Please consider making an investment in the future of healthcare through your financial support of our campaign, Building for a Healthier Tomorrow.